My name is Greg Cogoli. This is the place I usually go just because it's on my way home.
Okay. No questions.
And I've come to know the people here very, very well.
So this one here? Okay.
We're in one of two permanent facilities that the Red Cross has in Tucson. This facility does two types of collections. The first type is whole blood, in which a person comes in and they fill up a 1 pint bag of blood.
Oh, okay. Be about 2 hours.
Right now, I'm doing a platelet donation. Platelets are a component of your blood that are instrumental in the coagulation process, which is very important if you have a cut. It promotes clotting. Platelets are very valuable because they have a very limited shelf life of only 5 days. They have to be stored at room temperature, unlike whole blood, which is stored at around 43 or 42 degrees. And then they go to patients that need them. I tell people that it's natural to have a certain fear. If you've never done it before, it's not normal to have someone stick a needle into a vein. However, once you try it, then you realize that it's really nothing to be afraid of.
Good job. Thank you.
When Kai inserted my needle, I could barely feel it. And these phlebotomists are very, very skilled. Maybe someday, if too many people are afraid, the blood may not be there. That's what makes me afraid. And which fear is greater? And sometimes you have to conquer your fear. But there's a constant need for platelets, just like there's a constant need for whole blood. The statistic they give us at the Red Cross is 1 person every 2 seconds in this country that requires blood. It's much more common than you think. Okay. Perfect. Yeah. You have a chance to chill out. No one can really place any demands on you. Right now, I'm doing something that's more important than anybody else could demand of me. Sometimes maybe we'll talk about sports, but I would say movies is the most common topic. I watched the first half of it last time. I don't actually think I saw all the ancient ones, the Charlton Heston ones, right. But the new series, it's really, really good.
Yeah.
It's not hokey or anything. Hold it. Oh, there you go. I won't tell you how it ends. I won't tell you if the apes win or the people win, okay? Or who I'm rooting for. The more I give, it kind of really makes my desire to give even stronger. Like I tell them, I'll give until you don't let me come back. Okay, thank you very much. I've given whole blood about 150 times, and I've given platelets about 100 times. You can give platelets a maximum of 24 times in a year. I like coming here, so I space out my 24 donations every 2 weeks. The nice gold-colored one. That's the platelets and a little bit of plasma. Yeah. I just think it's a beautiful color, And I think it's very symbolic, of what's happening. Or just like gold, because it is gold to the people that need it. The maintenance of the blood supply is all held together by a shockingly small percentage of people who donate. Very few people ever donate. Okay? And of those people who do donate, a large percentage donate once and don't donate again. So it really, really behooves anyone that can to give it a try. You always have accidents. You always will have accidents. You always have surgeries, some of which require huge amounts of blood. You always have people that have certain disorders that require, constant transfusions. So all the more reason for everybody to give, no matter where they live. No one gets blood in the hospital except that they need it in order to survive. They don't go in because it's fun or it's going to make them look nicer. It's very serious stuff.
This is the 103rd time I have received blood. I got lousy teeth. It's a plate, and I can't enunciate properly. So I've got to slow it down. So. My name is Betty Halverson. I used to live in North Dakota for 52 years. It's outside of Grand Forks where the university is. I graduated from nurses training in 1955, and I worked 25 years on the night shift. I loved it. I could help people.
Okay, so I have a red blood, intact, cold, no lumps. Oh, it's O positive
O
blood.
positive, she's A positive, which O can go into A positive.
Okay.
The reason I need blood is I had a bleed between the stomach and the esophagus, but it's a slight amount, and I have it checked every 6 to 8 weeks to see if they can figure out where this bleed is. Behave yourself.
I will. Excuse me.
The blood is coming up the tubing to go into my body. Something so simple as putting it in here, and it could save my life. Life.
So the blood's getting to her right now.
There's no other word for it. Yeah. It's this is my lifeblood right there. So I'm very thankful somebody donated that. Thank you for donating.